guys, in this video I'll be talking about insulin infusion protocol, which is most commonly used in ICU for glycemic control in both type 1 and type 2 diabetes. The target range of blood glucose in ICU is 140 to 180 mg per dl as per Surviving Sepsis Guideline 2021. Let's talk about the indication. When to start the insulin infusion. If the capillary blood glucose is more or equal to 200 mg per dl, then take another sample 1 hour apart. If the two consecutive blood glucose level done 1 hour apart is still 180 mg per dl or beyond it, then in this condition we shall start insulin infusion. Let's talk about the preparation of insulin infusion. For preparing the insulin, we need to have insulin syringe. 840 unit of regular insulin, that means 1 ml to 39 ml of NS. To make the ratio of insulin, 1 ml is equals to 1 unit. Then prime the tubing with 20 to 30 ml of insulin that is prepared in 40 ml before infusing, because to prevent from binding of insulin to plastic containing PMO line. Let's talk about the insulin bolus. How much insulin is given initially by bolus before starting infusion. We need to divide the initial blood glucose by 100, then round up to the nearest 0.5 unit for bolus and initiate the infusion. For instance, if the initial blood glucose is 374 mg per dl, then divide 374 mg per dl by 100. That means it is 3.74. Then round up to the nearest. That means it is 3.5. Then we need to give 3.5 unit for 374 mg per dl blood glucose. Let's talk about how to initiate insulin infusion by using algorithm. As you can see in the figure, there are 3 algorithms: algorithm 1, algorithm 2 and algorithm 3. In most of the patient, we start insulin by using algorithm 1. For instance, if the patient blood glucose is 180 or above, then we need to start insulin at the rate of 2 ml per hour or 2 units per hour by using the algorithm 1 table. Whereas, if the patient like non-case of diabetes who is receiving more than 80 units of insulin per day, and patient who is having glucocorticoid, and also in the patient who has just underwent surgery like CABG or post-transplant, in this exceptional case, we need to use algorithm 2 for the fast recovery of the patient. For instance, if the blood glucose is 180 or beyond 180 mg per dl, we need to start insulin at the rate of 5 units per hour or 5 ml per hour. After starting insulin infusion, we need to know that how to adjust insulin infusion. After starting insulin infusion, we should always keep in mind that blood glucose will be decreased by more than 60 mg per dl in 1 hour. If blood glucose hasn't decreased by more than 60 mg per dl in 1 hour, then move one algorithm towards right, like from algorithm 1 to algorithm 2. If the patient is already in algorithm 2, then move from algorithm 2 to algorithm 3. However, if blood glucose is decreased by more than 60 mg per dl, then move one algorithm towards left, like from algorithm 3 to algorithm 2. If the patient is already in algorithm 2, then move towards algorithm 1. But if the blood glucose is still uncontrolled by algorithm 3, that means something wrong might happen. So contact with the endocrinologist as soon as possible to prevent from the life-threatening conditions like DKA, that means diabetic ketoacidosis, or SHNS, that means hyperglycemic hyperosmolar non-ketotic syndrome. Let's move towards monitoring. When to monitor the patient blood glucose if the patient is on insulin. If the patient is on insulin, we need to check the blood glucose every hourly until stable. But if 3 consecutive values are within the target range, then we need to monitor the blood glucose every 2 hourly. In some cases, we need to reduce the infusion rate by 50%. Number 1, from midnight to 6 am, because during this time period the patient do not eat. So we need to reduce the infusion rate by 50%. For example, if the patient need to be in 2 ml per hour or 2 units per hour by following the algorithm table, but if the patient is in between the midnight to 6 am, then infusion rates will be decreased by half. That means 1 ml per hour should be infused. And secondly, during the dialysis, because there is a high risk of hypoglycemic, so to prevent from hypoglycemic episode, we need to reduce the infusion rate by 50%. And thirdly, if the enteral or parenteral nutrition is abruptly stopped, to prevent from hypoglycemia, we need to reduce the infusion rate by 50%. In some situations, capillary tests render inaccurate results, like in shock, hypoxia, and dehydration, because in this following situation, peripheral perfusion is not so adequate, so inaccurate result might come. Therefore, in such situation, arterial and venous blood is best for a point of care. Now let's talk about the insulin storage. Sometimes if we do not store the insulin in a correct way, then insulin doesn't work properly. So we need to know about the insulin storage, how to keep the insulin correctly. If the insulin bottle is unopened, then store it in a refrigerator, especially in a top shelf of the door, and maintain the temperature in between 36°F to 46°F or 2°C to 8°C, but do not freeze it. And we need to keep in mind that we can store in a refrigerator until the expiry date. And in other hand, if the insulin bottle, reservoir or a pen are open, then keep it in a room temperature of 59°F to 86°F or 15°C to 30°C, and we can store the open insulin at a room temperature for maximum of 28 days. But do not keep insulin in a direct heat or a direct sunlight, because it might alter the concentration. We can discard the insulin bottle in following situation. If it is beyond expiry, we can discard it. If there is any color changes, like if the regular insulin turned out to the cloudy, then we can discard it immediately. If you see any crystallized particle or lumps inside the bottle, you can discard it as well. If any bad smell coming out from the bottle, you can discard it. If rubber stopper of the insulin is dry and cracked, you can discard it as well. If insulin draw from its original vial, should always be used within 2 weeks. If it is beyond 2 weeks, then we can discard it thereafter. Insulin in infusion set of an insulin pump should always be discarded after 48 hours. Now let's talk about the hot topic, hypoglycemia. The most common side effect of insulin, or the life-threatening condition that can be caused by insulin, is hypoglycemia. In adult, if the blood glucose is less than 75 mg per dl, we can consider it as a hypoglycemia. But if the patient is symptomatic, even if the blood glucose is less than 100 mg per dl, then we can consider it as a hypoglycemia as well. Let's talk about what to do if the hypoglycemia occurs. The first and foremost thing that we can do is to stop the IV insulin infusion. Secondly, if the patient is conscious, we can give sugar, candy, chocolates, or juice. Unfortunately, sugar, candy, chocolates are not easily accessible in ICU setting, so even if the patient is conscious, we can give IV 50% dextrose 50 ml. Then we need to check blood glucose in every 15 minutes until the blood glucose reached 100 mg per dl. Once the blood glucose reaches to 100 mg per dl, we can check it 1 hourly. And if the blood glucose is again beyond 200 mg per dl, or two consecutive blood glucose down 1 hour apart is more than 180 mg per dl, then start insulin infusion by moving one algorithm to the left than before. If the patient is in algorithm 2, then we need to start from algorithm 1. And if the patient is from the algorithm 3, then we need to start from the algorithm 1.